I want to welcome you to the information session on the Altus Dental Plan for grad employees and postdocs at UMass. I'm Leslie Edwards Davis. I'm the Director of Benefits for the UAW UMass Health and Welfare Trust Fund. And we also have with us Keith Witt from Altus Dental. Keith, do you want to introduce yourself?
Yes, good morning, and I am a graduate of UMass Amherst, and I won't tell you the year, but obviously it wasn't yesterday, and look forward to attending the meeting and sharing the information with you.
So we're going to go over the general aspects of the plan. I'm going to share my screen with a couple of slides, and then we'll go over some frequently asked questions if there aren't a ton of questions from those attending, but we'll make sure to cover all of the key points. So your dental plan is completely separate from the student health insurance plan. The student health insurance plan that you have through UMass does not cover the vast majority of things that the dental plan covers. So this is a supplementary plan to your health insurance plan. And the most important thing as a starting point is that you apply for this plan, because it's not automatic in the way that the student health plan is automatic. It does require an online application. We just completely revamped our online portal this year to make it simpler and more intuitive to use. It should take you less than 10 minutes to apply for benefits. And you should only need your most basic information, name, address, phone number, and your student ID number. You do not need to provide your social security number any longer, which is a great benefit that we're able to provide in terms of process. So you'll go to our portal, hwtf.org. The portal link is in the top right. You'll submit all of your information, and then we will send you a confirmation that you're enrolled in the plan. It takes at least a week for that to happen. And you'll have all of your plan information in that confirmation email. Links to finding a dentist, links to the plan description, links to downloading an ID card. So that email is important. Try to save that email. It does have a wealth of information in it. So the next step after enrolling is to pick a dentist if you haven't already. There are tremendous options for in-network dentists in the Amherst area, in the Northampton area, in the Greenfield area. No matter where you live in the Valley, you should have plenty of options for picking a dentist. We do recommend that you stay in network. That's the way that you make the most of your dental plan. Although it is still possible to see a dentist out of network if you have a reason that compels you to do so. And then you would schedule an appointment. We cover up to 4 cleanings a year, and you should definitely try to get those in while you have the chance to, because most dental plans don't cover that many cleanings. We cover your preventative and diagnostic care at 100%. So use the plan. That's definitely, sometimes our folks get so busy that they push off their appointments. That's definitely a priority for us, is to get you in that chair and make sure that you get your exams, your x-rays, your cleanings, to protect your dental health going forward. So this is just a screenshot of the new portal. Like I said before, that's where you'll head to fill out the application. It's as simple as we can make it. You send yourself a secure link using your UMass Net ID. Pay attention to the first screen. It's very important. It asks you to identify the members of your household, and it opens up family portions of the application later on in the portal if you say that you do have a partner, spouse, or children. So if you find yourself mid-application and you're not seeing options to add your family, back arrow to that first screen where it asks you who is in your household, and make sure that you include your partner, spouse, or children. And that will then open up subsequent parts of the application for you. So fill out the application. You can opt in or out of each benefit, and don't forget to e-sign your form. And this is the confirmation email that I was talking about that you'll receive a copy of with all of those important links. Definitely important to review that email and keep it somewhere safe in your inbox or in your folders. This is something that I recommend that everyone does after they are enrolled. And I think Keith can talk a little bit about this as well, but the importance of going to the altusdental.com website and just setting up your account and what then you have access to. Keith, do you want to give us just a general sense of what folks will be able to find if they register at Altus Dental?
Absolutely. Thank you. Could you go to the next slide, please, Leslie?
Yep.
So really important, all the functionality of the dental plan are at your fingertips on the web. And again, it's consumerism and education. I think I'm speaking to the right audience in that respect. So I think that number one is you want to find a dentist in the area. You might be a repeating grad student or returning grad student that may have a dentist, or you may want to refine your search. You can do that right there where you find a provider. You can also print, take a snapshot, pull up an ID card, text it to yourself, save it to photos, so you have that at the ready whenever you need it. And then last in the bottom middle, I think, is know your amount, know your accumulators, we'll call them, your deductible and your maximum amount. This runs on our policy year is September through August. So I encourage you to, this is the first step after enrolling, and then getting a checkup or a cleaning, finding that dentist early in the policy year. So that if something comes up or something's discovered, it's one of your natural breaks. Maybe you could schedule something that may be more involved, and we'll cover some of that further in the slide presentation.
Yeah, that's a really good point. So getting scheduled for that cleaning and exam as early as you can, and then that will enable you to schedule something that you might need to have done, like let's say a root canal or a filling in winter break when you have more time, or in summer break. So those exams are important. Try to get them in so that you know that you're in good shape in terms of your dental health. Again, I just can't stress enough that once you get that confirmation email, just set yourself up on the Altus Dental website, because then you can kind of set it and forget it and know that you're already set up, and not sort of be scrambling once you need a piece of information from that site to set it up. And we already talked a little bit about this, but finding a dentist, you'll see the Find a Dentist button on the main page of altusdental.com. There's also a link to it from our site, hwtf.org. And we also give you a link to just a one-page kind of summary of dentists in the area on our site as well. Like if you just want to look at the short list, you can do that. But this Find a Dentist link is useful in particular if you are not in the Amherst area. You might be doing research in another state and you're looking for a dentist. You can search in any zip code using that button. So it really opens up the entire network nationwide to you to find an in-network dentist. So this is our plan description. There's a link to it on our site. You'll be able to see the same description if you create your account on altus.com. We'll have copies of this available at the benefits fair on the 30th as well. It's really your go-to once you go to the dentist and you find out, oh, I need a filling. This is what's going to give you the summary of what is covered and at what percentage. So like I said earlier, diagnostic and preventative care is covered at 100%. So that's your 4 cleanings, your x-rays, and your 2 exams per year. Our year is 9-1 to 8-1, like Keith said earlier. And just a note, if you do choose to go out of network, which you can, that's not what we recommend, but you definitely can. Your claims would be paid up to the usual and customary charges at the 95th percentile. And we can talk more with you about that if you are making the choice to go out of network. But definitely take a look at this. Sometimes you'll see benefits you didn't even know you had, because our plan is robust and it does cover some things that not all dental plans cover. And Keith, I'm going to let you talk about some of those things.
Thanks, Leslie. We consider this a world-class plan, truly in its design, and really take advantage of it. There's really unique aspects of it, such as really robust design. Normally you see 180-50. This is 180-35 or 65% that we cover in the major category. And you also have orthodontia benefit. We cover 50% and we'll spend a maximum of $1,000 on your orthodontic treatment. But sort of extras that are just unprecedented, quite frankly, are the 4 cleanings, number one. It's rare that you see 3 cleanings in a plan, normally 2, but you're going to see 4 here, or experience 4, and get them if you have the time to do it. You also have adult fluoride. So the provider will automatically probably perform that procedure on you. Children have it up to 19, and the benefits have been extolled in quite detail in studies and analysis over the last 20 years since fluorides have been introduced to treatments in the dental realm. Athletic mouth guards for dependent children under the age of 19. I don't think we have a huge population of dependent children under 19, but if the kids are active, you can get coverage for the mouth guard. And going back to the 4 cleanings, it's like look good, feel good. You know, it's a mental health component. It's even a cosmetic rider here. You get a teeth whitening benefit. So these are wildly unique. And again, this plan is the richest that I know of, and I do this for a living in the union space. So please take advantage of it, and that starts with your checkup for cleaning as soon as you get to town.
Absolutely. And one note about cleanings too, especially if you've had a gap in your ability to go see a dentist. I know sometimes that happens when you're changing schools, changing employers. That extra cleaning can really go a long way to bringing you back up to a good baseline level. So those 4 cleanings will help you catch up if you have had a gap in having dental treatment done. All right. So what you can expect when you go to the dentist. So we do like to cover this because we have lots of folks who are from other countries, other places, and it's not always the same kind of process. So what you can expect is that starting point, baseline, exam, x-rays, and cleaning, like we've talked about a few times already, which are covered at 100%. Then if the dentist identifies that you need additional procedures, that's when you would take a look at your plan summary to understand more of what's covered. And we always suggest that you ask for a pre-treatment estimate. And I'm going to have Keith explain why that is an important step.
Yes, and a continuum of care. You go to the dentist, you get a cleaning or a checkup, they discover something you weren't aware of, and they want to have you back. Typically, that indicates that you have more work. Maybe something is innocuous as a cleaning or a filling rather, but it could be something major like a crown or an implant that has a lengthy treatment process. It could be anything that's suggested to be more than $300. We always recommend that you ask the provider to submit a pre-treatment estimate to Altus Dental. That pre-treatment estimate is good for 1 year. It has to be performed by the dentist that provided it. But it does some other efficacy things underneath the surface, but ultimately most folks want to know what it is it's going to cost me. And knowing that the plan is so well and so richly designed that you have a $2,250 annual max, that means that Altus Dental will spend on you personally and any dependent you might cover $2,250 in that policy year from September through August. So again, back to when you go to the functionalities of the plan by registering online, you'll be able to tap into these amounts, you'll be able to view this stuff. But again, rules of the road, get your checkup. If you have something you know you need treatment for, get a pre-treatment estimate. And again, that should be returned to you very quickly, maximum of 15 business days. The guidance is sent back to you and your provider. And network providers particularly work closely with this and are more adept at handling. When you go to an out-of-network provider, they submit them, but you should probably be really mindful in suggesting or asking or requesting that they submit that pre-treatment estimate.
Absolutely. So I do sometimes see dentists that will prepare an in-house estimate, and that is not a real pre-treatment estimate. And if you get one of those, you can just ask for a pre-treatment estimate, which is where Altus gets pulled in and they know exactly what's covered on your plan. Sometimes dentists make best guesses based on other types of plans that exist out there, but they don't know your plan. So that's why they need to connect with Altus, look at exactly what's covered under your plan, and then get that in writing with all of the parties involved, Altus, the dentist, and you. It's just much clearer and much more reliable than an in-house estimate. So definitely ask for one if you're not receiving one. And then we have a snapshot of what a pre-treatment estimate might look like. So in this case, the dentist is recommending a crown, and there are some other ancillary procedures that need to be done. This estimate will show you the dentist's charge, what's allowed under the plan design for the dentist to charge for that procedure, whether there's a deductible involved, what your percentage of coverage is for that procedure. On this example, it's 50%. For our plan, crowns are covered at 65%. And then what the plan will pay on your behalf and what your expected contribution will be. So it's a clear layout of what will be covered. And again, super beneficial if you're having anything other than, your cleanings and your exams done. One thing I like to point out is that once you do go to the dentist and have something done, you'll get what's called an explanation of benefits. And this, correct me if I'm wrong, Keith, this first appears, the earliest appearance of this document is in your altusdental.com account, and then it gets mailed as well, hard copy.
That's correct. We actually, you'll be able to view them, online through the portal. And the ones that we mail are only really adverse decisions where we're waiting for additional information or we're reconsidering the claim or certain circumstances. But these are the things you get in the mail that are sort of a nuisance, but you can tap into them online. And they're going to coincide with any treatment that you have. I think in this example too, it has this is a filling example, data service, the procedure code, the dentist charge, and this is zeroed out. And then it shows the allowable, consider it being in network, the deductible, co-insurance, but it says amalgam 3-surface filling. I think that's fairly unusual these days. It's normally going to be one of those white composite resin-based fillings. So amalgam's not a great example, but you get the picture. You've seen these before, and this should not cost you much, especially if you're in network. And maybe a little bit more out of network.
Yeah, I use this example just to point out a couple of things. It's really important that it says this is not a bill. So the submission of claims to the dentist, to the insurance is a process. Sometimes the dentist won't include all of the information that needs to be included for the claim to be processed. And so you'll get an update of what stage the processing is in on this explanation of benefits. Sometimes it will say more information is required from the dentist. And I just want everyone to know that this is not the final bill. That's why it says it very clearly. This is a snapshot of what's happened so far in terms of processing. So if there looks like there's an error or there's more information that needs to be provided, that can all be done and this will be revised. But it's good to know that that's a good reason to go set up your altusdental.com account right when you get enrolled, because that's the earliest place you'll be able to see this explanation of benefits. And that's where you can go to right after you've, had your procedure done and check to see if your EOB is ready.
If I could interject, Leslie, it's also always good you can call customer service. They're very, very good. I think always trust but verify, and you can call them, they'll walk you through it, and they'll, in any situation, don't be afraid to use the toll-free number on your ID card.
Your Altus is very accessible in terms of asking questions. So you can ask me questions, but you can also go directly to Altus customer service, and they are definitely going to help you with whatever you need. So just to go over some of the terms on that explanation of benefits form, because sometimes it can be confusing. Again, there's what the dentist charged for your care. There's the allowable amount, which is the amount the insurance is going to pay for a typical procedure. There's the deductible, which you will not need to be concerned about if you stay in network. The deductible is only relevant if you go out of network, and it's the first $75 per year would not be covered, and then the plan would kick in after that, only if you go out of network. And then there's the plan payment, which is the amount Altus will pay on your behalf to the dentist. So sometimes it's good to just have an example. And again, this is not necessarily what your course of treatment will involve, but it's an example to show you kind of how the insurance works. So let's say you go to a dentist, they're an in-network dentist, which is great. And you get exactly what we are suggesting you get, all of your baseline items taken care of, your exam, your x-rays, and your cleaning. Let's say the dentist charges $159 for that visit. You won't have that deductible because you're in network and because these are preventative and diagnostic procedures. There should be no charge to you at the dental office. The plan will pay at 100% to the dentist, and your responsibility would be zero. This is the most common scenario that you'll see using our plan. Most of our members use our plan for diagnostic and preventative care, and you won't see a charge at that in-network dentist. And then we have a second scenario. This is the out-of-network scenario, just to show you kind of the impact of going out of network. So let's say you go to an out-of-network dentist and you get a filling done. Fillings under our plan are covered at 80%, and you would be responsible for 20%. But because there's that out-of-network deductible, the math changes a little bit. So let's say you go to the dentist and the charge is $225. That first $75, if you haven't met the deductible yet for the year, will not be covered. And then the benefit is now based on a bill of $150. The allowable charge for the filling might be $120. The plan would pay 80% of $120, and you would be responsible for $132. After you've met that deductible for the year, you won't have to meet it again. But you can see when you get dinged with the deductible, you end up with something that you need to pay out of pocket, and it's best to just avoid that by staying in network.
Yes, and in this scenario also, you would probably most likely have to submit a claim form.
Exactly. So another downside of going out of network is that you submit the claim yourself in a lot of cases, because since the dentist isn't in the network, they're not required to do so. So that's just a whole nother step of submitting paperwork in order to get your reimbursement for what the plan covers. It's just it does not make your life easier. Make your life easy and go to an in-network dentist. So if we just had to recap what our advice is, like I just said, pick an in-network dentist. There are many of them to choose from, and many are on a bus route from the UMass campus and within less than 5 minutes from the campus. So there's definitely plenty of options. My recommendation is to ask folks who have been in your department for a couple of years who they go to, because they're going to be the best representative on their experience at a local dentist's office, and they can say, oh, I love my dentist, or, you know, I'm looking for a different dentist. And that's a good gauge of who you pick on the list. it's just like anything else. You can ask for recommendations from other people who are using the plan. Ask for a pre-treatment estimate if you're having anything other than just your diagnostic and preventative work done, and register on the altus.com site after you've been confirmed to be enrolled in the plan. I did add a new screen this year because we do get so many questions about wisdom teeth, and I'm not going to cover it in depth today because we do a whole webinar just on wisdom teeth. And we have lots of information we can send you about how it works. But just as a brief overview, when you have your wisdom teeth removed, if they are impacted, you actually have two plans that could potentially cover the removal of impacted wisdom teeth. So the student health plan, if you're enrolled in that plan, covers removal of impacted wisdom teeth at 95%. Like I said, the student health plan doesn't cover dental procedures in general, but they do cover a couple of narrow things, and this is one of them. And so what you will want to do if you have impacted wisdom teeth, you'll want to first give the dental office your student health plan information and ask them to build that plan first. You'll also give them your dental plan information because the Altus plan will cover 80% of what's not covered from the first pass by the student health plan. So 95% will be covered by the student health plan. The remaining amount will be sent to Altus, and they cover removal of wisdom teeth at 80%. If you don't have the student health plan or you don't have impacted wisdom teeth, your dental plan will still cover removal of wisdom teeth at 80%. But the final note on that is we're happy to assist in helping you coordinate these benefits, understanding them, understanding how they work and what order they should be billed, because it can get a little bit tricky depending on the scenario. So we do a lot of interventions on helping walk you through this, and we're happy to do it. This is at a glance your basic information for your student health plan and your dental plan. You'll see your group number. You will be assigned an ID number in the Altus system. There's the customer service number that Keith mentioned before. There's the network name and the URL for their website. And that is everything I have. Keith, do you think that there's anything important that we might have missed that you'd like to add?
No, I think we covered the basics and just the rules of the road. Enroll, register on the website, find a network dentist, get your checkup early in the policy year, and if they want to have you back for anything further, you want to ask them to submit a pre-treatment estimate. And I'll look forward to seeing some or all of you there next week during the benefit fair. And I think Leslie put together a great program. Thanks for the audience.
Thanks, Keith. Definitely come join us on August 30th, next Wednesday, 11 to 2, Student Union Ballroom. Keith will be there answering questions about the dental plan. I'll be there helping people enroll. There's 40 tables that will be there of different organizations, providers. There'll be a local in-network dentist there. So tons of folks who are there to answer questions that you might have. But other than that, thank you for joining us today, and take care, everyone. Thanks, Keith.
Thank you.